This is Dr. Ateeq from Ateeq Dental Care. So today the topic which we are going to discuss is related to diabetes mellitus. What is diabetes? In common pupil conception, diabetes is basically a high rise in blood sugar level. Diabetes usually affects our body system and the main targets are our eyes, which ultimately led to eye blindness. Second is our kidney. When diabetes affects our kidney, the end result will be renal failure. Our kidney will stop working properly, and the end result is failure of the system of the kidneys. And the third thing is our nerves. Our nerves also affected by diabetes mellitus because of decreased blood supply. Main issue in diabetes mellitus is ischemia. Ischemia is decreased blood supply to vital organs of our body. Even in the oral cavity, the blood supply to our teeth and associated pulp is reduced in diabetic patient, which ultimately lead to necrosis of the pulp of our teeth. So, if we discuss the effects of diabetes on our oral cavity, the first and most important effect is xerostomia, also called as dry mouth. What will happen when we have reduced salivary secretion or no saliva in our mouth? As diabetes affect our salivary glands, so it affects the production of our saliva. And in case of reduced salivary secretion, our mucosa ultimately led to ulcerate, cause of friction of the mucosa. There is no lubrication media in between the mucosa. So there is higher chance of ulcer formation in the oral cavity as well as dental caries. As saliva function to clean our teeth. When there is reduced or no saliva in our oral cavity, then there is chance of dental caries in our teeth. Second thing is our gingiva or gums, which are also affected in diabetes mellitus. What will happen with the gingiva are supporting structures of our teeth. Diabetes affects the bacteria residing in the oral cavity. Usually there is balance with the bad and good bacteria. But in diabetes mellitus, what will happen? Imbalance. Bad bacteria increase and good bacteria decrease in count in the oral cavity. Loss of homeostasis in the oral cavity, which ultimately lead to infections in the oral cavity. Different patients presents with multiple abscess formation in the gingival area, in the gum tissue of oral cavity. And second most important factor is immunity. Immunity presented by different immune or defense cells like neutrophils, macrophages, which are also affected in the diabetes mellitus. First of all, chemotaxis of the neutrophil is affected by diabetes mellitus. Second, phagocytosis capacity of macrophages also affected in the diabetes mellitus. Third, the effect of diabetes on the gingiva is on supporting structure. There is periodontal ligament, which is mainly made of collagen fibers. Diabetes effect on the collagen is that collagen turnover blocked by AGEs. accumulated glycation end products. So the old collagen persists, and the old collagen is less resistant to microbial invasion or microbial attack. So ultimate what will happen? Periodontitis, inflammation of the supporting structure of the teeth, and ultimate result is mobility of the teeth and difficulty in mastication with mobile teeth. So these are the effects in the oral cavity of diabetes mellitus: reduced salivary secretions, gingival recession, gum recession, mobility of the teeth, altered bacterial flora, immune defense defects, and important is old collagen persistence in the periodontal ligament. So overall effect, the supporting structure of teeth. Diabetic patient present with severe periodontitis along with multiple abscess formation. So patient present with acute pain usually, and it depends on its condition of diabetes. If it's uncontrolled, the condition will be more worse. There will be polyps, pedunculated areas in the gingival tissues, and abscesses formation in especially in the uncontrolled diabetes. If diabetes is controlled, the effects are less, or maybe or sometimes the condition is near to normal conditions. So today topic is basically the manifestation of diabetes mellitus in oral cavity of immunocompromised patient, which whose immunity is compromised by the diabetes mellitus. So whenever a patient presented to you with diabetes mellitus, always stress on controlling the diabetes. Otherwise, no benefit will gain by scaling, root planning, root surface debridement, prophylaxis. All these procedures have no benefit unless the diabetes is controlled. So hopefully the information is beneficial to you. Kindly subscribe and share my channel so that in future further informative videos will be shared by this platform of Ateeq Dental Care. Thank you.